Thank you for joining us today. My name is Josefina Batten. I am the Long-Term Care Quality Director for QSource, and with me I have Sarah Sutherland. Sarah is a Quality Program Manager for QSource, and today we will be discussing QAPI, or Quality Assurance Performance Improvement. This training is made available to you through CMP grants. Our agenda for today, we will be discussing what QAPI is, what it means to the facilities, and the requirements associated with CMS participation. Sarah will be discussing further into the 5 elements of QAPI and root cause analysis. So what is QAPI? Quality Assurance Performance Improvement was initiated in 2010 to assist facilities in identifying deficiencies, implementing plans of action to correct those deficiencies. So let's talk a little bit about the CMS regulatory environment. The guidance associated with the regulatory environment are directly related to the tags F65 through 944 that really delineate, they give the facilities a guided plan as to how to implement a QAPI plan that will be successful, that includes data collection and monitoring, that you have a systemic change within the facility through improvement activities, and QAA committee, as well as training, and we will be expanding further. The first guidance that I want to discuss is F65, that has to do with the facility QAPI program or plan. So this guidance was implemented in November in 2018 as phase 3, right? The CMS mega rule. And it delineated that the facility must develop, implement, and maintain an effective, comprehensive data-driven QAPI program. Well, what does that mean? It means that you get the opportunity to address every aspect of long-term care areas. For example, dietary, housekeeping, that it's not just centered on nursing, on clinical aspects, and that you focus on indicators of outcomes of care as well as quality of life. Maintaining documentation and demonstrating the evidence of QAPI. So it's not just you gathering your team and making sure that the projects are being carried out, but it also adds that you have to demonstrate that there's evidence of such, right? And just know that this tracking of quality improvement processes through documentation has to be available to the state survey agency or federal surveyor. They will come to your facility and ask of that evidence. And the QAPI plan also has to include a design and scope. What areas it is, what goals and mission it is that your organization is trying to accomplish, and include those within the QAPI program. The next guidance that I want to talk about is FA66 QAPI, or QAA, data collection and monitoring. This is what we spoke about earlier, and all of this guidance kind of links together. They complement each other. And so on this aspect, it is to collect and utilize that data to move and perform, to acquire quality outcomes that are positive. And this can be used to guide, for example, a performance improvement project to a certain area that you have identified as being a priority, right? That is why you collect and use that data. It used to be that facilities would collect data, but they would wait to really use those important trends to make changes. So this really expands on the monitoring, evaluating, and moving priorities throughout the environment. FA65 guidance moves you through the QAA improvement activities, and Sarah will be discussing the 5 elements of QAPI. But I think it's important for you guys to understand that this is a systemic approach. And what I mean is that you're not just looking at sentinel events, you're looking at continuous improvement activities, conducting projects, determining what plan of action is best, and involving those frontline staff to identify the priorities and making sure that there is a way to make change and sustain change within your facility. Even if at some point throughout this gathering of data, you identify that maybe a policy doesn't work or the approach that you used did not sustain change, and even evaluating your QAPI plan as a performance improvement project. So it really looks at every aspect. As you think about your plan, you also have to take into consideration who will be part of your committee. So FA68 gives you an opportunity to know that the facility must maintain a quality assessment and assurance committee. So even if you don't have per se an ADON, or you don't have an infection preventionist, or you don't have a certain important role that you think should be in the QAA committee, I think it's important to know that the plans, the trend gathering, the data gathering still has to happen, and identification of those members of your team that can make an impact in quality assessment and carrying out the projects. It's important. And I invite you to really identify those leaders within your facility that are frontline staff, because that is the way to really sustain change when you get the buy-in from your frontline staff. With the QAA committee, you have to at least have 3 quarterly meetings and coordinate activities under the QAPI program. This is not limiting you to only 3 quarterly meetings. I think it's really healthy to know and understand that every time that you gather a trend, especially if it's a sentinel event, that it's important for you to act upon it as quickly as you may. Why is that? Because you don't want a negative outcome to happen over and over again before you're able to perform upon it. So it's really important to act on the spot, maybe have an ad hoc quality assurance meeting or a QAPI meeting, and implementing a program that will improve that outcome. As far as the guidance related to the QAPI training, it's and I tell you this from firsthand experience, that it's important for your frontline staff to know, as facilities receive surveyors, whether it's state surveyors or federal surveyors, they will be asked what their knowledge basis is regarding QAPI. What is the role that they play? What project are they involved in? So it's really important for you to carry out those trainings related to their role and what you're trying to accomplish. I think that making sure that your mission goals, your facility goals match what your frontline staff are trying to carry out on a day-to-day basis, and trying to achieve those positive outcomes is important. And at this time, I will hand it over to Sarah Sutherland to speak about the 5 elements of QAPI.
Now that you've learned about the origin of QAPI and the regulatory requirements, let's talk about the important elements of a QAPI program. Design and scope is number 1. A QAPI program must be ongoing and comprehensive, dealing with a full range of services offered by the facility, including the full range of departments. When fully implemented, the QAPI program should address all systems of care and management practices, and should also include clinical care, quality of life, and resident choice. Number two is governance and leadership. The governing body and/or administration of the nursing home develops a culture that involves leadership seeking input from facility staff, residents, and their families and/or representatives. The governing body should foster a culture where QAPI is a priority by ensuring that your policies are developed to sustain QAPI despite changes in personnel and staff turnover. Number three, feedback, data systems, and monitoring. This element includes using performance indicators to monitor a wide range of care processes and outcomes, and reviewing findings against benchmarks and/or targets the facility has established for performance. It also includes tracking, investigating, and monitoring adverse events that must be investigated every time they occur, and action plans implemented to prevent reoccurrence. Number four, a performance improvement project, or PIP, is a concentrated effort on a particular problem in one area of the facility or facility-wide. It involves gathering information systematically to clarify issues or problems and intervening for improvements. The facility conducts PIPs to examine and improve care or services in areas that the facility identifies as needing attention. Areas that need attention will vary depending on the type of facility and the unique scope of services they provide. Number five, the facility uses a systematic approach to determine when an in-depth analysis is needed to fully understand the problem, its causes, and implications of a change. Systemic actions look comprehensively across all involved systems to prevent future events and promote sustained improvement. This element includes a focus on continual learning and continuous improvement. The five elements are your strategic framework for developing, implementing, and sustaining QAPI. These are the responsibilities for each long-term care facility as part of your QAPI program. The QAPI manual. Your QAPI plan or manual should address all five elements. Your plan is based on your own center's programs and services, the needs of your particular residents, and your assessment of your current quality challenges and opportunities. Your self-assessment tool. CMS developed a self-assessment tool to take your QAPI pulse. It will assist you in evaluating the extent to which components of QAPI are in place within your organization and identifying areas requiring further development. It will help you determine how you really know whether QAPI is taking hold. You may use the self-assessment tool as you begin your work on QAPI and then for annual or semi-annual evaluation of your organization's progress. You should complete the tool with input from your entire QAPI team and organizational leadership. This is meant to be an honest reflection of your progress with QAPI. The results of this assessment will direct you to areas that you need to work on in order to establish and sustain quality in your organization. Lastly, performance improvement projects, or PIPs. We discussed PIPs in element 4 on the previous slide, and it's important to remember your facility's PIPs should be comprehensive and involve committees and subcommittees as needed. When putting together a team or committee for your PIP, be sure to include a multidisciplinary team. The main committee should include a chairperson or team lead, the director of nursing, as well as the physician for the facility. Subcommittees should include other staff members, especially frontline staff. Root cause analysis, or RCA, is a term used to describe a systematic process for identifying contributing causal factors that underlie variations in performance. This structured method of analysis is designed to get to the underlying cause of a problem, which then leads to identification of effective interventions that can be implemented in order to make improvements. RCA focuses primarily on systems and processes and not individual performance. There are a few different methods and tools to utilize when performing an RCA. Number one is the 5 Why method. The 5 whys is a simple problem solving technique that helps to get to the root of a problem quickly. The 5 whys strategy involves looking at any problem and drilling down by asking why or what caused this problem. While you want clear and concise answers, you want to avoid answers that are too simple or overlook important details. Typically, the answer to the first why should prompt another why, and the answer to the second why will prompt another, and so on. Hence the name 5 whys. This technique can help you to quickly determine the root cause of a problem. It's simple and easy to learn and apply. The second method is the PDSA, which stands for Plan, Do, Study, Act method. During a PIP, you will try out some changes and then see whether or not they made a difference in the area you were trying to improve. In the plan stage, the team learns more about the problem, plans for how improvement would be measured, and plans for any changes that might be implemented. In the do stage, the plan is carried out, including the measures that are selected. In the study phase, the team summarizes what was learned, and in the act phase, the team and leadership determine what should be done next. The change can be adapted and restudied, adopted, perhaps expanded to other areas, or abandoned. That decision determines the next step in the cycle. And lastly, the fishbone diagram. A cause and effect diagram, often called a fishbone diagram, can help in brainstorming to identify possible causes of a problem and in sorting ideas into useful categories. A fishbone diagram is a visual way to look at cause and effect. It is a more structured approach than some other tools available for brainstorming causes of a problem, such as the 5 whys tool. The problem or effect is displayed at the head or the mouth of the fish. Possible contributing causes are listed on the smaller bones under various cause categories. A fishbone diagram can be helpful in identifying possible causes for a problem that might not otherwise be considered by directing the team to look at the categories and think of alternative causes. Include team members who have personal knowledge of the processes and systems involved in the problem or event to be investigated.
Thank you, Sarah, for that comprehensive review of the QAPI plan as the 5 elements are developed and the process for quality assurance performance improvement projects and root cause analysis. As mentioned before, you have the availability to continue to make changes within your long-term care facilities while implementing a comprehensive QAPI plan and involving your frontline staff and making sure you have processes in place to making sure you have an organized manner for carrying out projects and also sustainability of such projects, which is an important aspect of QAPI. Thank you so much for listening to this webinar today. We are so excited to have this opportunity. You can follow us on Facebook and Twitter and LinkedIn. Again, if you were to have any questions regarding the QAPI process further, don't hesitate to reach out and we will be able to provide you with assistance. Thank you.